my name is Rachel and I have chronic Lyme disease. I was diagnosed probably close to a year ago now and have been treating for about 8 months. And I've gotten a lot of questions about my experience with Lyme and the treatments that I'm doing. So I thought that I would just do a Q&A video just going over a lot of the questions that you guys have asked, and you guys asked some good ones. So the first one is, how did you know you had Lyme disease? Okay, well, it's kind of a long story, but when I was in high school, I was sick for about a year or so, pretty sick. Like, I missed a good majority of that year of school. Anyways, we were having trouble figuring out what was going on, and I tested positive for a tick-borne illness. They said there's no way that I could have something like that because I couldn't recall a tick bite. And so I was never treated for it, and we just kind of never thought about it again after that. And it turned out that I also was diagnosed with celiac disease, and after I started eating gluten-free, things started to be going a lot better, and I had some actually really good years and was able to go through most of college doing really well and being active. I did kind of have a few sporadic months of unexplained symptoms and being pretty sick, but for the most part I was doing really well. And then a little over 4 years ago I got sick and I never got better. And throughout these past 4+ years we've kind of just been on this journey of trying to figure out what is wrong, because I went from being this extremely active person to being very sick, and so we knew something was wrong. Along that journey I was first diagnosed with POTS, and then later diagnosed with intracranial hypertension, Chiari malformation, then Ehlers-Danlos syndrome, and craniocervical instability, Teller cord syndrome, the list goes on. I was told that I had a negative Lyme disease test, so we just, thought, okay, I don't have Lyme. Honestly, once I got an EDS diagnosis, we kind of felt like we had the answer of okay, EDS ties together all these other illnesses and problems that I've been having, and so we didn't really look any further after that. After my craniocervical fusion surgery and Chiari surgery and Teller cord surgery, I was still really sick, and it really didn't help that much. And so I decided to go to a naturopath doctor, and I was like, I haven't tried this yet, I'm willing to do anything to feel better. She did a lot of testing, and I had some markers that made him suspicious for the potential of Lyme disease, and he kind of wanted to do this trial to see what my reaction was to this natural treatment for Lyme disease called samento. I started taking that. A couple days into it, I was getting really high fevers and body shakes and just worsened flu-like symptoms and worsened symptoms that I had already been experiencing. And what's interesting is that I actually haven't had a fever the entire time that I have been sick these past 4 years, and so I knew that it was strange that was happening, and ended up not really feeling great about that doctor that I saw. But I did really feel like we were onto something with Lyme disease, and so I did a lot of research, and we found a really good Lyme doctor to see, and he did testing for Lyme, Bartonella, and some other types of infections, and my Bartonella testing came back positive. That was testing done with Galaxy Diagnostics, for those that might be wondering, and my Lyme testing was just standard, I think, Western blot, and I actually tested positive for a couple of strains, and in order to have a full CDC positive for Lyme disease, you have to meet a certain number of positive strains, and so my Western blot had always come up negative. So a lot of you guys had asked, you know, did I have a positive Lyme test or was I diagnosed clinically? And the answer is kind of somewhere in between. So there's a lot of controversy surrounding how Lyme disease should be diagnosed and, you know, like what tests are the best. Some people might say hygienics has better testing than something like Western blot, but unfortunately testing for Lyme disease is not very accurate, and so diagnosis is still often made clinically. Also, unfortunately, most doctors are not very knowledgeable about chronic Lyme disease, and so it makes it kind of tricky to rule out. But if you do suspect Lyme disease, I guess my best suggestion would be to find what they call a Lyme literate doctor, and there are searches you can do online to try to find a Lyme literate doctor in your area. So I did get a lot of questions about the diagnosis process and whether my testing was positive or negative, and was it diagnosed clinically, and all those things. So for me, it was a little bit of both. I was partially positive for Lyme and very positive for Bartonella, which is another infection that is kind of similar to Lyme and often goes along with it. A lot of doctors also will say that if you're given some sort of Lyme treatment and you have what's called a Herxheimer reaction, where you have a flare-up in symptoms a few days into that treatment, then that can be a good sign that you have some sort of chronic infection like Lyme. For me, that was the most confirming thing, was seeing that like really bad Herxheimer reaction to the treatments, and that's kind of what confirmed to me, like, okay, yeah, I definitely must have some sort of chronic infection going on to have a reaction that strong to something that normally wouldn't cause any kind of reaction in somebody that didn't have a serious chronic infection. So a lot of people asked something along the lines of, you were diagnosed with EDS and then later you were diagnosed with Lyme disease. Do you have both, or do you not have EDS anymore? Like, what's the deal with that? To be honest, I'm not really sure. I was diagnosed with HEDS by a geneticist, and I meet all the diagnostic criteria for HEDS. I feel conflicted about EDS in general. In my own personal situation, just because I know that Lyme and other chronic infections can mimic conditions like Ehlers-Danlos syndrome. It can break down your connective tissue and cause all of the same issues that EDS can cause. Maybe I had mild EDS, but getting this infection made the EDS portion of things way worse. Maybe in my case, I don't have EDS at all, and Lyme is just mimicking EDS symptoms. I don't know, it's so tough. Like, I just feel like there's so little known about these chronic conditions that there's really no way to know for sure. I just really hope that they do more research on, you know, connective tissue disorders like EDS in relation to chronic infections and that sort of thing, because I feel like a lot of people are like me in that, like, they kind of saw some signs of EDS and then all of a sudden, like, they got really sick and things just went super downhill at some point in their lives. I think there's a lot more unknown about these conditions than there is known, which is kind of scary, but I think there's a lot of hope for the future and research with all of those things. So, okay, next question. How do you differentiate Lyme symptoms from other illnesses? That's kind of along the same lines. Like, I don't know. I don't know if my POTS is caused by Lyme. I don't know if all, you know, my Chiari and tethered cord and craniocervical instability and all those things, maybe those are all caused by chronic infection too, there's really no way to know. My personal guess, which probably doesn't, you know, mean much, but my guess would be that, you know, they would all be related to the chronic infection. To me, it makes sense to have like kind of like a one root cause rather than all these random illnesses happening at the same time. What were your first symptoms? So when I first got sick 10 years ago in high school, my main symptoms were severe headaches, fatigue, and dizziness. I had those years where I was better, and then things got a lot worse after that, and I've developed a lot more symptoms. I think I might go more into detail with my Lyme symptoms in a different video, just because this video is probably already going to be pretty long. Let's see. So, next question. What is your treatment plan? So basically, I'm doing kind of a combination of antibiotics and natural Lyme treatments, and the main antibiotic that I've been on is tetracycline, and the natural treatments that I have been doing are monolaurin, samento, and oil of oregano. I personally have stronger reactions to the natural treatments than to antibiotics, and not everybody is that way. I knew when I kind of started this journey with Lyme that I was going to get people telling me like, don't take antibiotics, it'll ruin your life, or don't do this, don't do that, like whatever. And honestly, like, I'm doing what I feel good about, and that's what matters to me. I'm just supportive of people doing any kind of treatment that is going to help them, whether it's with pharmaceutical drugs or whether it's a more natural treatment. Like, whatever makes you feel better, awesome. Back to the treatment plan. My doctor does something called pulsing, and he believes the treatment for Lyme works better when you do kind of 10 to 14 days on the treatments and then 10 to 14 days off. So that's what I've been doing for the last 8 months or so, is doing these pulses of antibiotic treatments, and we've changed and added in certain things along the way. I've also done a few pulses of doxycycline. I think we're just trying to figure out what works best for me, and my doctor recognizes that I'm a pretty complex case. This infection has likely been going on for 10 years now, and so it's going to be a tricky thing to treat. As for the amount of time that he expects the treatment to take, I think he expects about a few years, but it really just depends on how I respond and how I'm doing. There's no like, we're gonna do this for 2 years and then we'll be done. And I tend to be kind of more sensitive, and so we kind of have to take baby steps in these treatments, and he has stronger treatments in mind for me down the road, but he doesn't think that I'm like quite there yet, so we're just working our way up there. And another factor for my case in particular is that I am on steroids. Taking steroids kind of makes it trickier to treat chronic infections like Lyme in general, so that's just like another thing that kind of is making this process longer than what a typical Lyme treatment would look like. Let's see, what is a Herx reaction and what happens? Okay, so I know I talked about Herx reactions earlier, and I hope I'm not confusing you guys too much. I think sometimes I feel like I never really know where to start when I am telling my story with Lyme and talking to other people about Lyme, because I feel like it's kind of just like a whole nother world that I had to spend a long time to really like research and understand it. But I wanted to read what my doctor had written up on his website about Herxheimer's. So he says, a Herxheimer is a flare of prior and or new symptoms in association with beginning an antibiotic or natural therapy in certain infections such as Lyme. They occur at different time points based on the drug and the infections present. They can range from mild to severe and include an exacerbation of underlying symptoms as well as the development of new symptoms. Examples may include, but are not limited to, flu-like symptoms, headaches, eye pain, muscle and joint pains, fatigue, sleep disturbance, tingling and numbness, and psychiatric symptoms. I believe that Herxheimer's and chronic Lyme patients are due to the combination of relatively small amount of bacterial destruction and a relatively larger amount of blubbing. And he has a lot more about that on his website, and so I'll link that below so you can read more about it if you want to. I don't want to go too much into detail about that or confuse anyone, but basically a Herxheimer reaction is kind of when your symptoms get worse before they get better with treatments. How is the LDN going? LDN is going really well. Actually, LDN is known for being a treatment for Lyme disease and has helped a lot of Lyme and chronic infection patients. I started it close to a year ago now, and I'm up to 3 milligrams a day, and yeah, it changed my life. It brought me from a point where almost every day I didn't know if I was going to make it. I was that sick, and it helped me kind of come out of that really bad flare, and kind of has helped me stabilize. It's kind of taking me from this really bad flare back to like my baseline of chronic illness life, and so I have a long ways to come, but I'm so thankful for what LDN has done for me. Have you ever considered stem cell treatment? So stem cell treatment is a type of like alternative treatment for chronic Lyme disease, and a lot of people actually travel outside of the country to, if you are in the United States, to have it done. It's definitely controversial, but there are a lot of people that, you know, say it gave them their life back, and that's awesome. And personally, it's not something that I would be considering right now. I guess that could change in the future, but my Lyme doctor tends to try to play things more on the safe side, and not do like, you know, like IV antibiotics or anything like super invasive or more risky, just because he, in his own patients over the 20 plus years that he's treated Lyme patients for, he hasn't seen any better results with IV antibiotics versus just orals. I'm actually really thankful that, you know, he's erring on the side of caution, just because I feel like I tend to be someone that has bad reactions to treatments in general. Right now, no, I don't think we would be considering stem cell, but I think it's awesome if it works for you. This is a good one. Has your Lyme treatment helped with your craniocervical instability or intracranial hypertension symptoms? If you knew about Lyme before your surgery, would you have delayed surgery until after Lyme treatment to see if it helped CCI? I love this question because this is something that I actually think about almost every day. Yes, I think I would have delayed my fusion surgery and tried Lyme treatment first if I had known about Lyme. And the reason for that being is fusion surgery is a very invasive thing to do. It's permanent, it's for the rest of your life, and it's, you know, it's risky, and though I was told by multiple of the top neurosurgeons that I saw that there was no way I'd be able to avoid the fusion surgery and that I needed it, I still think I would have tried Lyme treatment first, and that's a very personal decision, and I'm not giving anyone advice as to what to do on that, but I think there is a possibility it might have helped. And then again, I do know some people that treated for Lyme for years and then had to have the fusion surgery, and so, you know, I think there's probably a better chance that I still would have had to have the surgery, but yes, I would have tried anything possible before having that surgery, because I still think about it every day. Anyway, okay. How does your doctor monitor progress with your treatments, and if they are making you sicker with Herxes or like overall better? He's really good about that. He goes over all my symptoms, and we kind of talk about like the Herxheimer reactions that I've had, and then like how I'm doing overall versus, you know, a few months ago or in the beginning of treatment. And I do think that overall I am doing better than when I started treating for Lyme disease. At the beginning of last year, I was so sick that sitting up for 10 minutes talking with my family or any kind of thing that would cause like overstimulation would often like send me into uncontrollable shaking and seizing like episodes. Like, I was so sick. And now I can do more, and sometimes I like kind of forget how far I've come because I still have days like that. I still have days where I can't get out of bed and have bad reactions and really bad symptoms, and overall like my functioning level is pretty low in comparison to like when I was healthy. But when I compare it to when I started Lyme treatment, like, there's no denying that I'm doing better, and I'm so thankful for that. I really didn't know if I was going to make it. I'm doing better overall. You can tell that we're headed in the right direction with this. Okay, what side effects are you having from treatment? I don't know if I'm having a lot of side effects, but I am having the Herx reactions that we talked about earlier, and the Herx reactions can range from, you know, just a little bit worse than my normal baseline symptoms to like really, really bad ER level symptoms. I've had a lot of worsening of headaches, neurological symptoms, chest pain, fatigue, muscle and body aches, that sort of thing. Does Lyme only present with neurological symptoms? No, it actually presents with a whole range of different symptoms, and that's kind of why Lyme is often referred to as like the great mimicker. A lot of times people have underlying chronic infections with things like autoimmune diseases. A lot of people will have joint issues or heart issues or flu-like symptoms, fatigue, just pretty much any symptom you can think of, which really does make it hard to diagnose and treat. Like I said before, it's really hard to know where to start when talking about chronic Lyme disease, because it's just like a whole another world that felt very overwhelming to me when we first started treatment. I will plan to do more videos about specific Lyme related topics as I continue to treat for Lyme disease and Bartonella, and as I continue to learn more about it. I hope you guys are all hanging in there. Happy New Year. I know it's been a while since I have posted a video, but I have a goal this year to post 2 videos a month, and so I'll do my best to do that for you guys, and hopefully eventually I'll go back to weekly videos. But if you would like to follow along, then be sure to click subscribe, and I will look forward to seeing you guys next time. Bye!